Hey guys, what's going on? So apparently today, Governor Baker's put a soft travel ban into effect for the Commonwealth of Massachusetts. I got this via the text update, which the governor has stressed it's not going to be bombarding us with information. If you would like to receive Massachusetts updates, please text COVID-MA to 888-777. You can get the same updates that I'm getting right here, so... But I just wanted to jump into this because there were actually some very surprising things, because Governor Baker is not messing around at all here. So, where'd we go? Oh, I went ahead. Nope, there we go. Okay. So today, the Baker-Polito administration announced new COVID-19 public health emergency responses, issuing new guidelines on travel and transportation and offering further support for healthcare professionals and patients. Earlier today, Governor Charlie Baker, Lieutenant Governor Kathleen Polito, Senate President Karen Spiloneka, my apologies, and House Speaker Robert DeLeo also announced an agreement to extend the 2019 state individual income tax filing and payment deadline from April 15th to July 15th. So that's matching up with what President Trump had done federally as well. These next two things are something that I really want to highlight. So number one, travel guidance. Beginning today, March 27th, all travelers arriving to Massachusetts are instructed to self-quarantine for 14 days. This guidance will be displayed along posters at service plazas along I-90 eastbound, distributed as flyers at major transportation hubs, and posted on highway message boards. Visitors are instructed not to travel to Massachusetts if they are displaying symptoms. Healthcare workers, public health workers, public safety workers, transportation workers, and designated essential workers are exempt from this requirement. And no, they're changing the med school graduate. This right here, emergency limited medical licenses. As soon as I saw this, hold on, I gotta scroll over more for you, don't I? No. Here we go. I'm actually just looking at it now. Okay, so here we go. Emergency limited medical licenses. The Board of Registration in Medicine will provide medical school graduates who have matched as an intern, resident, or fellow with a board-approved Massachusetts healthcare facility or training program with emergency 90-day limited licenses to practice medicine to ensure that our healthcare workforce is prepared during the COVID-19 public health emergency. I'm not sure I've ever heard about this before. I mean, it wouldn't surprise me if it's used in certain disaster areas and stuff like this, but I mean, this seems like Governor Baker. I mean, I saw that thing going around about a bunch of healthcare workers. I think it was WGBH, the article that I saw, that they were stressing the governor to do more. It appears like he's listening. Maybe he's not taking, it seems to be ratcheting up over time. And again, we realize that once we're past this, that our civil liberties will be returned. To qualify, medical residents must fill out an application to be approved by the program or facility, and once approved, residents will receive the emergency license to be able to start when their program begins. This emergency limited license will allow medical staff to provide support while the regular screening processes, and this is not a substitute for the regular limited license process. Okay, so again, please, anybody, if you've heard about this before, let me know. I mean, here's the thing. I shared this with some individuals on a stream a little bit earlier, and they're like, well, what are their qualifications? And apparently he just kind of missed the part where I said, well, these are medical school graduates. They've actually graduated medical school. They found placement in a particular program as well. And I mean, if it's to help with a lot of things, such as administering a proper test, this or that, this is likely things that I would assume, again, I am not a doctor, healthcare professional, or any type of professional within respects to that. I would think that they would have gone over a lot of this. And you know what? This is all hands on deck. This is the thing. It's like, we're all in this together. You're looking at the folks that are coming down with the virus. It's like the virus don't discriminate. The virus don't care who you are or where you are. It just wants to replicate and move on. So I just wanted to give you this little update here from the Commonwealth of Massachusetts. And, hey, we can make it through this. So thank you all for watching. Peace out. Be safe. And long live the elbow bump.